My name is Erin Wilt. This is midterm reflection for 732C. So the two areas that I selected to address were assessment and then therapeutic communication. I did this based on how I feel in clinical, at the end of clinical each day, and then also on the feedback that I have been receiving on some of my patient logs. So for assessment, for me at this point, it is difficult to complete a thorough assessment that feels fluid and not so regimented without losing the structure. And that is some of the feedback that I've been receiving on my patient logs, is that I am missing some areas, or some parts of the assessment are not fully completed. And I feel like that's because during the session, I don't want to continue to ask just questions. I want to be able to, guide a conversation to obtain the information that I need for a complete assessment, but I'm just losing that ability somewhere along the line at this point. So I'd like to work on learning how to use transitional questions that can guide the conversation for me to, circle back to get what I need without it seeming like I'm just guiding and asking question after question after question, so that it does allow the participant or the patient the ability to speak freely, have a fluid conversation. I feel like we have more genuine responses and quality sharing in session if they do feel like it is conversational as opposed to one-sided. So that is going to take me learning my own style to integrate assessment skills or questions or techniques, so that I can have a conversation. They can share openly with me, but I can still get the information that is required for documentation and formulating an appropriate treatment plan. So that's something that I'd like to work on as far as assessment goes. For therapeutic communication, this applied mostly for me to the adolescent demographic. It seems to be the most difficult for me at this point in obtaining the information. The same techniques or the same, approach or questions that are often received well or work with the adult population do not seem to have the same impact or be as effective in the adolescent demographic. So it's going to take me learning how to navigate this population to, I think, develop the rapport and the trust, because they do seem more receptive to my preceptor and giving her the information. And they seem like they almost have like a bond with her, that they can come in and they sit down and it seems almost like a friend talking back and forth. Whereas when they're engaging with me, it's almost like the demeanor kind of changes, and it almost feels like when you're sitting in class and you're speaking back and forth, a teacher and student. So the communication is definitely important to me so that I can establish that same rapport, and they can have the same quality session that they are having with my preceptor that they would be having with me. It seems like I had said, it seems almost like they are reserved, which does not correlate sometimes with the way that they are described to me when my preceptor and I are consulting, or even in chart documentation. So that's important to me, and I think it is just going to come down to establishing the therapeutic alliance, the rapport, which does come down to how we're communicating verbally and also the body language that we're presenting. So I did find it helpful in one instance to be able to relate to them. There was a young lady that was having some concerns with college, coming up, and she had a lot of questions, and she didn't feel her parents were receptive in helping her. And, I have a child that is at that age as well. So I was able to kind of give her some suggestions and say, hey, maybe check out the Common App. It gives you all these ideas for schools that you can apply to, and how you go about that process and the timeline. And at that point, it looked like the way we were engaging and the willingness for her to speak, back and forth openly with me did transition. So it may just take, again, building that relationship that they can trust in you, so that, they are more receptive to me in the future. I would like to have a goal by the end of the clinical term to improve the ability to conduct a comprehensive assessment, completing 80% of required assessment components structured, but still conversational manner, utilizing, two age-appropriate therapeutic communication techniques, which in this case for adolescents, I would believe it to be direct communication, providing respect and confidentiality, of course, within limits. And then an additional one would be like shared decision-making even. So I intend to do that, reviewing the adolescent psychiatric assessment framework weekly with my preceptor just to look at areas for improvement, observing Allison, who is my preceptor, to identify, how she's building this rapport and communication techniques with her team or of patients there. And then completing just a brief reflection every day after clinical. How did the assessment go? What was the patient engagement like? Communication effectiveness. Hopefully, by implementing these strategies, I can become more confident and efficient in conducting the thorough assessments, and then also just capitalizing and continuing to build on therapeutic communication.